All right, Scott, you should be all set to get started, and we have the recording going.
Great. Well, good afternoon or morning if you're on the West Coast, everybody. Um, Thank you for joining us today for the webinar on knee pain and prevention of knee pain and self-care opportunities. My name is Scott Eiselt. I'm the VP of Clinical Operations for IMC. For those of you who have joined us for the previous webinars, you're probably familiar with the process, but I'll take a brief moment just to introduce what IMC is and what we do. So IMC stands for Integrated Musculoskeletal Care. We are a musculoskeletal care company that has physical therapists and chiropractors, and we provide care for things like any kind of joint in the body that's hurting, neck pain, back pain, pinched nerves, muscle or tendon injuries. I joke that if it moves and it can hurt, we can evaluate you for it. And so that's the kind of care we provide, and we do so with a very specialized assessment process to help identify specific type of problem you have and where you should go, and what type of treatment you'd be a candidate for. So given that as our background, we've learned a lot about how to not only resolve joint problems, but then once they are resolved, how to teach people how to keep them from returning. And then we've used that same kind of process. If you can keep somebody from having a problem again, and you use those similar strategies, you can often then prevent the onset of many of joint problems that tend to arise for a lot of us. All right, so that's kind of a background. So let's see if we can. So as far as the webinar today, we're going to talk briefly about the knee itself, how it works, the anatomy, mechanics of the knee. It won't be an anatomy lesson by any means, but at least then everybody's familiar with the joint itself and what it looks like. And we'll touch on, it says knee pain prevention, but really knee health. Like, what are the things that contribute to a healthy knee joint, and what are potential knee pain sources, and how do we address those? And then we'll dive into some preventative self-care opportunities. And then lastly, we'll give you some options for care if you have a problem that is potentially in need of care beyond self-care or preventative strategies. All right. I will say, as we're going through this, if you have any questions, feel free to put them in the chat. I'll leave enough time at the end that we'll kind of rifle through the questions and make sure that everybody has an opportunity to get those answered. All right, so the first thing, some facts about about knee pain and our joints in general. Should maybe say facts and or myths. And so age, a lot of, if I was at a health fair recently, and those familiar comments I kept hearing, like, well, I'm getting older, so I'm going to hurt. And although as we get older, there's an increased chance that we're going to have a joint issue, age in and of itself is not often the primary reason why a joint is hurting or doesn't work properly. Okay, it can be, but that's actually the lowest percentage. Often it has to do with maybe a soft tissue problem or the joint itself, or maybe the nerves that feed that joint. All right, and so if you're someone who thought that, hey, as I get older, I'm guaranteed to have knee pain, or my parents, when they reached this age, they had knee pain and knee replacement, that is not your destiny, okay? So as we get older, we do not have to hurt, all right? Joint health, it is possible to maintain it as we age, all right? Many changes in our joints have to do with our patterns and what we do, but also what we choose not to do with the joint as we get older, all right? And so I put age on here is that it is not a determining or limiting factor when it comes to joint health, okay? Next one is degenerative changes or arthritic joints. Okay, so as we get older, our joints start to demonstrate signs that they're older if we take images of them, X-rays, MRIs, CT scans. As you get past your 20s and 30s, you start to demonstrate the wear and tear of those joints that those decades have been putting on them. And so even pain-free, fully functioning joints under imaging as we get into our middle and later ages, demonstrate degenerative arthritic changes. But not every pain-free joint with those, not every joint with those changes. So not every joint that shows those signs is painful. Okay. So depends on how that joint presents and how it's cared for. And so, again, this is kind of one of those statements like age. It can be the reason you're hurting, but there are also then things you can do to either maintain joint health, improve your joint health, or you can have an assessment to determine, well, I know I have arthritis, but is that why my joint hurts? Okay. So those are things to just be considering. Okay. And too often we're given, oh, you have an arthritic joint or you have degenerative changes in your knee. In this circumstance, that doesn't mean that you don't have an opportunity to potentially improve the way your knee functions and feels. Okay. That kind of touches on imaging. I won't belabor that much. All I'll say is imaging has a place. We hear a lot about imaging when it comes to like professional athletes and all those, if somebody has a bum knee from they twisted it playing or this or that, they get imaged right away. And that's for a different reason. There's a lot of reasons why they do that. I won't get into that here, but our body has an amazing ability to heal itself and recuperate. When it doesn't demonstrate the ability to, even with attempts to care for it properly, imaging is a great thing. Or if I've had a trauma, right? Or if there's a question and something seems atypical, imaging has an unbelievable place in our assessment process. But with that comes findings that are relevant and irrelevant. All right. So just take that with a grain of salt. Okay. Surgery. A lot of people think, well, if I have something wrong inside my knee, I need to have it fixed in the form of a surgical intervention. As I touched on earlier, our body has an amazing ability to heal and recuperate from injuries, things that aren't working properly. If it didn't, you can imagine the shape we would all be in, given the stress and strain we put on our bodies over our lifetime. Okay. And so surgery is actually probably between 3 and 5, probably 2 to 3%, right around 3% of people will have a need for a surgery if they have knee pain, but it's definitely not the overwhelming majority. Okay, so a lot of opportunity if that's something you're not interested in. All right. Next one is inflammation. I would say inflammation gets a bad rap in our society. You can't turn on the TV or listen to much of anything without an anti-inflammatory ad or hearing about things that are highly inflammatory for our body. So inflammation as a result of an injury is an extremely healthy part of the healing process. And if we block it or try to get rid of it, it actually undermines the healing process. Okay, so we need our body to get inflamed if we just got hurt so that we can properly heal, right? However, that said, chronic inflammation that's not going away in a reasonable time frame, that is not part of the healthy healing process. So when inflammation is impairing the ability for somebody to function or heal, that needs to be addressed. And similar to the surgery numbers, it's probably in the realm of about 3 to 5% of cases. Okay, so it's often not the root cause. And then last two, repetition and prolonged positions. We are creatures of habit. And so what that often entails is that we move our joints the same way every day to the same ranges. And so we maintain often those ranges and abilities because we do it all the time. But those repetitive activities and prolonged positions, we can start to neglect certain parts of the joint. We don't move to its extremes or we don't use it a certain way. And that's then where problems can start to creep in and they can start to reside. And if we don't identify those, that is where then they can start to limit our function. Or we don't notice them and we try a new activity and then our limitations of that joint are exposed because of the newness or the surprise we created. All right. And so we'll go through some real easy low-hanging fruit movements for the joint, but to help mitigate some of those issues. But moving your joints through their full available motion, which we'll get into in a minute, is very, very important. Last but not least, the overwhelming majority of joint problems, believe it or not, are actually rapidly changeable. Okay, so a problem that's originating in the knee, IMC finds that over 60% of those can change rapidly. That means you can reverse the condition typically in a matter of weeks, all right, and then learn to keep it from returning. All right, there are other types of injuries, no doubt, that would make up the other 40%, but just know that many conditions, the overwhelming majority, are very changeable. All right. All right, so the knee itself, you've got two long bones, all right, that were the femur on the top and then the tibia on the bottom, all right, they meet to create the knee joint. And then we'll call it like a floating bone, which is your kneecap that sits on the front of the femur. All right, so that makes up the joint. All right, and then there's cartilage, which makes the joint slippery on itself. And the joint is also filled with synovial fluid that's a lubricant of sorts. Okay. Also on the surface of the tibia, on the outer edges, think of it like the outer edges of like a golf tee, if you will. There's like a collar, all right? And that collar holds the joint and stabilizes it in the form of a meniscus, all right? A lot of people hear about meniscus injuries or tears. And then you have ligaments, which are the soft tissues that connect the two bones together, all right? The ligaments provide stability and keep the joint from moving too far in a given direction, all right? And then lastly, you have tendons, which are formed off of muscle and attached to the bone. So when we use our muscles, they pull on those tendons in order to move our knee joint, right? And so those can be susceptible to injury, but any of the things I just listed can be part of the joint that can be injured, so to speak. All right. So again, muscles, tendons move the joint. The joint's made up of two bones, and they're connected by soft tissue ligaments that hold those bones in the right positions. Okay. All right. So knee health. All right. What are things that can help keep our joints healthy? An active lifestyle. All right. Number one on the list. Contrary to popular belief and opinion, potentially, is we do not wear out our joints. We often would, some would say we rust out. So someone who uses their joints on a regular basis, keeps them healthy through doing that, you're stimulating a healthy joint. You're telling the body you need that joint to work properly. So the body maintains those tissues, keeps them with a high vitality. Sedentary individuals, people who don't use the joints, protect them. Those joints become more fragile. They tend to break down. They tend to show a higher percentage of degenerative changes as a result. Okay. They also then are not as resilient when you put stress through them, so they're more easily injured. Okay. So remaining active in some degree, it's important. That doesn't mean everybody's got to do plyometric workouts, but keep using your joints and keep doing the things you want to be able to do. All right. If you can't do something or you haven't done something in a while, gradually increase the forces through that joint so you don't surprise it, and let your body then modify itself to allow you to do it. All right. Maintaining range of motion and flexibility. Use your joints in the full extent of their motion, preferably daily, if not on a regular basis, to maintain them. We start to stiffen as we get older, not because we're older, but because we stopped moving our joints into certain ranges. Okay. So if we moved our joints to their full extent of their range every day, we should maintain that range as we get older for the most part. Okay. All right. So it's very important to force the joint to its extreme. People used to say, don't lock your knees, don't let your knees go over your toes. And a lot of that has been determined to not necessarily be the best advice. Okay. Force your joints to their limit. Which is the end range joint movement. Lastly, active lifestyle strengthens the surrounding muscles and tendons, like I talked about. So keeping them strong through some type of strength training or resistance training, it keeps them more resilient, and then they're going to be less likely to be injured if you had to do something that was maybe out of the norm or stress them more than they're typically used to. All right, so tendons are really strong structures, and we typically only injure them with overuse, all right, or a surprise, all right, like we tripped and fell, or something causes us to do something that's way above their typical workload, and then that results in injury. We touched on the repetition and prolonged positions. Two things there: interrupt the positions you're in on a regular basis, all right, and move into positions you rarely are in. Okay, so you maintain that joint's ability to go there. All right. So everybody on the call, many of us are probably sitting. Some might be standing if you have a standing desk. But if you're sitting, your knees are probably bent. And if you sit for work, they're probably bent most of the day. So we'll get into this in a minute, but fully straightening your knees out more often can help maintain the ability to fully straighten the knee, and also then is tied to better joint health. Right? Last but not least, address painful impairments. I would say to people, if you have something that pops up, people, should I go see somebody? Well, we're going to give you some self-care options here in a moment. But I like to tell people your body's really good at healing itself. Right? So it's okay to be patient if you're seeing improvements. So let's say over a 2-week time frame, you start hurting. In a matter of 2 weeks, you should be able to notice that you're improving to some degree. If you are, you get another 2 weeks. But if at some point in that process you're plateauing, all right, and you're not seeing continued improvement back to where you're used to being, you should get that looked at, all right? Because that painful impairment can turn into something bigger or limit your activity, and then you're going to have kind of the cascade of events that comes from that. All right, so we're going to dive into some knee pain sources here and some things we can do to prevent or potentially self-care in certain circumstances. All right, so if you've been in some of these over the course of the year, we've talked about the connection between our spine and joint pain that is in our arms and legs. Okay, the knee joint is no different than the rest of the joints, and that there is a connection, and that a study that was done back in 2018, they took patients that had local joint pain only, and they evaluated them to determine where was the source of that pain coming from. For someone who had knee pain, they would evaluate their lower back to see if the nerves that control the knee are causing that knee pain, or if the source is from locally at the knee. And what they found was 26% of the people that presented with knee pain, the source of their pain was actually coming from the lumbar spine or the low back. Okay. And what that means is that their problem was then resolved by moving or using treatment strategies on the lower back, not at the knee. Right. So it's an important study that tells us that anytime we start to see knee pain, we need to at least test the lower back to make sure it's not the problem, because 74% of the time it was the knee. Okay. It also should tell us that if we're going to prevent knee pain, a robust prevention strategy has to include some low back prevention as well. Okay. Otherwise, we're going to leave an opportunity to potentially experience knee pain if we don't take care of our back as well. Okay. So keep that in mind when we have some prevention movements that I'll show you in a little bit. All right, some other sources. So that was the spinal source. The second one on the list is the joint can become the source. All right. Now, when I talk about this, there's a rapidly changeable joint problem that we often see. And this is often typical that the joint is not getting something it needs. And once it gets that movement, we can drive change and resolve the problem in typically days to weeks. Okay, this is not a months long process. And it's really extremely obvious. And it's between 60 and 65% of knee problems. All right. So very common. The joint movement I'm going to have you guys do today or put on this, and I'll also give you a resource where you can find some other ones like that, is meant to prevent that problem or potentially resolve it if it's in a low severity state. The third one, I think we probably hear a lot about people have muscle or tendon injuries. This could be tendonitis or tendinopathy or a muscle strain or pull around the joint. You can have ligamentous injuries, so anything from a tear, like a ACL tear that people have, or a sprain where that ligament was overstretched. All right. And then the body often heals that with a scar, and that ligament has to be then remodeled. All right. Another thing that can happen with ligaments is they can be underutilized. Same thing with tendons. And so if we neglect certain movements, they start to go through adaptations. All right, our soft tissues do, tendons, ligaments. And so if you don't stretch or move a tissue, it starts to degrade or it starts to shorten in length. All right, so it becomes weak and tight. All right, and then when we go to stress it, it's painful because the body says, hey, we're weak and we can't move that far. So human nature is, well, I don't like pain. I'm not going to do that then. And that's often the source of stiff joints as we age, is we neglect certain movements. So then we start to then adapt to what we do all the time. Right? Those are very reversible changes. Unfortunately, they take months to fully reverse. Okay. But because they're often seen in somebody who's maybe later in life, oftentimes then arthritis will become what is the diagnosis, and people will get joint replacements and things like that when there may have been an opportunity for them to restore normalcy to that joint or improve and not need that joint replacement. So it's an important differentiator, all right, in that regard. So I would urge somebody, if you're, thinking about joint replacement or you've been told you might need one or any type of surgery based on an image, is to get an evaluation to see if there's an opportunity for you, no matter what that image looks like. Last but not least, there's an other category, and these are things that, let's say a knee is inflamed. Well, that often will need medicine of some sort, okay? Or a structural problem, like there is actually then either a tear or something arthritic change that is truly the source. It's degenerated to the point where we can't reverse that problem. Those are there, and sometimes we can't resolve those. Movement can help, but it isn't going to take it away. And then that's where other interventions like injections or surgeries are great options. All right, so now to prevention. So I touched on 26% of knees can be from the back. All right, so I'm going to show you. We've looked at these before. If you haven't ever been on one of these, moving your back backwards, okay, either in the lying down position as we're showing here, repetitively, so 8 to 10 repetitions at a time, or bending it backwards over a countertop or table. All right. The reason that's preventative is we live our life in a forward bent position, sitting, bending forward thousands of times a day. So we want to do the movement that keeps the joint healthy and functional, which would be the opposite of what we're often doing throughout the day. Okay. All right. So just kind of show them both at each time. Now, which one should you choose? Either one is good for any population, all right? We do find a slight bias that those that 50 years of age or older often do a little better in the standing, with the standing one against a countertop. But that doesn't mean you shouldn't try the other one if you wanted to, okay? All right. All right, so if you have knee pain, this is something that's worth trying to see if it affects it. If you want a full, robust prevention strategy, you should do this, because it's going to prevent not only back pain, but it's going to prevent hip, knee, foot, ankle pain in the lower limb. All right, now, as far as the knee is concerned, which movement is the most preventative? Well, our knees go in only two directions, thankfully. They straighten and they bend. Okay, so the straightening direction, all right, is the most preventative. And when you do this, it might look like, oh, you're just kicking your knee straight. But in reality, you're supposed to be tightening the thigh muscle on top of the joint, and you're trying to lock that knee as straight as it can possibly go and hold it for a good 3 to 5 seconds. Okay, so fully straightening your knee, making sure there's no more range that could possibly go through, keeps the knee capable of fully straightening given that it's bent most of the time. Okay, all right, that can help just maintain that motion that was often lost. So that, if you don't have a problem, establishes a normal. I know how that motion feels, all right? And that's your normal, all right? And if you do that a couple times a day, for instance, you'll then keep that joint movement available, right? Now, let's say you all of a sudden start feeling like, man, it's really hard for me to straighten my knee today. Well, that's an indication that the joint has actually changed slightly, and you're going to want to do that movement then more often. And you would typically then see yourself trend back to the normal just in a matter of a few days. Okay. If it's a long-standing problem, you can still attempt that. But if you're not seeing changes, that's where then some other care strategies would be probably recommended at that point. Okay. So other care strategies, number one would be self-care. All right. So I'm gonna at the end here, we'll give you a web app, but there's an application that we have a self-assessment tool, and you can go in there and tell it what your problem is, and it'll show you how to test your own joint to see whether or not movement, and you can resolve it on your own without the need to see another individual like myself. Okay. It's a great option for somebody who doesn't, not sure they really want to go through the full care process. Okay. Um, Another option is our virtual care network. And so we have clinicians that are available in every state. And so, regardless of where you live or how IMC is part of your health plan, we can see you from a virtual perspective through telehealth. Or it's like a FaceTime call. And all the movement tests that we have, for the most part, we can teach you to recreate them over the course of a call. And we actually find that we get the same results as we do with in-person as far as outcomes are concerned. All right. There's some minor limitations as far as being able to, do certain things, but we just get creative around those. So this is a great option for somebody who maybe isn't near an in-person clinic of ours that really wants to go through an evaluation process. Okay. You can get a robust evaluation. And here's an example of the two: in-person clinic care versus telehealth outcomes are essentially the same. Okay. And then last but not least, if you have a problem and you're like, and you happen to have some of our, we have locations in various places around the country. There are in-person options available to you. You can always reach out and identify one of those close to your local home. All right, here's that web address. You can do app.jointstrong.com or scan that QR code, and you can find all the resources. There's also a preventative menu so that would re-show those videos, teach you those movements. If you go in here and make an account, you can click on any joint and find some prevention strategies. So that is I know it leaves a few minutes. It's kind of fast and furious here, but Nick, it's probably easier. I don't know if you have the chat open, but it's easier. I want to leave this slide up. Do you have anybody that had a question?
Does not look like there are any comments in the chat so far.
Great.
Okay, it looks like we just got a question now. So the question is, how do you feel about deep squats as it relates to knee pain and so forth?
Great question. In a normally functioning knee, no problems. Deep squats are not bad for you. Let's put it that way. You're asking the joint to move through its full range, which is really healthy. You're stressing the muscles and tendons, also okay. If it's something new, I would just make sure that you have full kind of body weight squats and then slowly work up if you wanted to do them weighted. Okay. If you try them and they're painful, it's going to sound interesting, but try them over time and see if it just naturally gets easier and easier the more you do them and less painful. If it doesn't, well, that'd be an indication that that's kind of those painful impairment things. I would have it addressed then. I would get it looked at. If you want to be able to do deep squats, then you can have somebody look at, okay, well, what's going on in the knee that's not letting you do it? Okay. But it is a very normal and healthy movement. Great question.
So we just got another question as well. So for help with lower back pain, how do you feel about hanging, like on a bar, for example?
Oh yeah, like hanging upside down, or people use inversion tables. It feels good. It's slightly decompressing. However, most back pain involves like the joint not being able to move properly or even the joint position. So when you hang yourself upside down and put some traction through it, it takes the pressure off of that joint, but in some cases it doesn't correct the issue. So it ends up being more of a management tool as opposed to a tool to resolve the problem. Okay, so it's not going to harm you. I've never seen that, but I liken it to if you had a rock in your shoe and you sat down and it went away, well, you decompressed the pressure on that foot and on the rock. Okay, but when you get back up and you didn't move the rock, it's still going to be there. All right. And so you got to correct it by getting the rock out of your shoe. Same goes for some pains. And then if we're just managing it, you might find yourself having to hang upside down a lot, you know? So I've only seen it in a couple of rare circumstances resolve the condition. Most often when I come across patients, they're using it as a management tool and it's not correcting the problem.
Cool. I think that was the last question.
Right?
Yeah, there's just another comment about uh, someone in the chat that consistently performs the first exercise in the slide for low back screen that you had, but
Oh,
doesn't
great.
look like we have any other questions.
If I could give that person a virtual high five, I would. Good job. Um, so very useful back exercise. So, well, if anybody has
Oh,
any
Sad,
questions, yeah.
we just got one more question actually. So, if an individual has undergone meniscus removal in one knee and is currently overweight but working towards weight loss, is there a recommended weight threshold at which jogging or stair use should be avoided? Additionally, is it possible to re-injure the same area after the meniscus has been reviewed? I mean, sorry, removed.
Great question. If if you were jogging on a joint that had an impairment that was too much force on the knee joint, it would become painful, or after the fact, all right, you'd have pain that wouldn't go away. And so if you ease into it and it lets you, you're not going to, the human body doesn't let us injure it without a warning most of the time. All right. So there isn't a specific weight load. However, running compared to walking and standing is extremely more forceful on the knee. However, that doesn't mean you shouldn't do it. It's a very healthy thing. So for that piece, the question on the meniscus part, can you re-injure it? Yeah, I mean, you're just as likely to re-injure it as you were initially. When they don't necessarily always remove the entire meniscus. A lot of meniscus in tears that are some of the surgery, they do a meniscectomy, so they take out the torn portion. Think of it like a hangnail, and they clip off the fraying edges and clean that up. All right. Some meniscal tears are larger than others, so some people have more removed than others. So you can get aggravation in that area, or you could have another injury. Um, but I think it sounds like you're doing all the right things. You're trying to live a healthy lifestyle. You're trying to then add activities that are, going to contribute to stronger and healthier joints and soft tissues. If you start to hit impairments or barriers, though, don't hesitate to reach out to a service like ours to help you along the way.
1 minute. Looks like we got one more question, which was, can soft or hard insoles help with knee pain?
Um, I would, they're going to change, maybe how the ground feels or how, as far as if you're on firm surfaces and give you some cushioning on the soft side. On the hard side, they're more supportive and they're going to sometimes, though, change the way your foot works. Some of the research on that is actually quite mixed in that, um, changing the way our foot works, sometimes it works a certain way naturally for each person. So that's a very debatable issue. So is it possible? Yes. If you have knee pain, I kind of liken it to hanging upside down, and then you apply what I would call an indirect treatment to it, like insoles or swapping shoes or things like that. That doesn't mean it's not going to affect it. It could. It could make it feel like, oh, this takes the pressure off, or it's more tolerable. But if it isn't correcting it, I still would recommend an evaluation of the knee itself to see what is that exactly hurting, and then can we figure out why, all right? As opposed to applying maybe indirect things like braces or insoles or change of shoes and footwear.
Cool. All right. I think that is all of the questions.
Great. Well, thank you everybody for attending. Like I said, use this website if you need a resource, and have a great rest of the year and a happy Thanksgiving.